Hey, I'm Sarah Smith, family doctor, clinical day advisor, and the chatting coach. Welcome back to Sustainable Clinical Medicine podcast, where we're going to be interviewing peers or world experts who can help us think about our clinical day in a way that is more sustainable and create time for our lives outside of medicine. Welcome back, everybody. Today we have with us Dr. Jeannie Lawrence. It's so nice to have you here. Welcome.
Thank you for having me. I'm excited to be here.
Perfect. All right, tell us a bit about you.
Let's see. I'm Dr. Jeannie Lawrence. I'm a board certified psychiatrist. I've been practicing for 16 years or so here in the States. I guess we'll start with like how I got into medicine and psychiatry and all of those things. My mom was a registered nurse. I believe she planted the seeds for me to be somewhere in the healthcare field. There aren't any physicians in my family, but she always made sure that I was exposed to what she was doing. So I would go to the hospital with her. I met her nurse friends and her doctor colleagues. I was actually a candy striper when I was a teenager. And so I was one of those girls that went around the hospital in those pink and white little uniforms. And so I got a comfort level with being in the hospital setting pretty early on. I'm a multi-passionate person. And so I did not have any thoughts early on that I would be a doctor or really do anything in medicine. It was just a way that I was connecting with my mom at the time. But when I was in college, I had an experience where I was able to volunteer at a free medical clinic that was close to our campus. And that really started to further water the seeds that maybe being in healthcare and in a clinical setting might be a good fit for me. I really loved just being in the clinic and feeling like I was helping people. And that's ultimately what I did. And in terms of psychiatry, I always say that I didn't choose to be a psychiatrist. Psychiatry really chose me. When I went into med school, I did not know that was an option for me, that psychiatrist for medical doctors. I didn't know any of that. And I actually remember being on a tour, like a pre-med tour, walking the campus before I started school. And I happened to be walking with one of the deans of the school who is a psychiatrist. And I said something that in retrospect was very embarrassing for me to say to her, but I turned to her and I said, "Oh, I didn't know that I didn't know psychiatrists were medical doctors." And she was very gracious and kind and said, "Yeah, yes, we are. And you can be too." And ultimately, that's what I decided to do after all of the rotations and really finding that psychiatry felt like hand in glove to me in a way that other fields and other rotations didn't. I really loved just being able to be with my patients and listen to their stories, and the pace that allowed me to really dig into their stories and just hold space for them and understand them in a deep way. And I really fell in love with this idea that I could make a difference. I remember as a med student on the wards, it felt at that time as a very young and naive student that we were doing something very magical on the psychiatric unit because people could come in very decompensated. And you can imagine a patient who's in the throes of a mental breakdown or a psychotic break or something like that. Within a few days or weeks, they would be totally normal and talking to me like I'm talking to you now. And that was always the turnaround, I think. The idea that I could be a part of changing somebody's quality of life like that so quickly really resonated with me. And so that's how I got into medicine and psychiatry in a nutshell.
Yeah, yeah. Tell us about career as a psychiatrist. What did you discover about working in that field? How does it go in the system of psychiatry?
Yeah, never a dull moment. I loved practicing psychiatry. I still love psychiatry as a discipline for sure. Over the years, I've practiced in many different settings in the community as an ACT team psychiatrist, where I was a part of a multidisciplinary team seeing very sick patients in their homes with the intention of trying to keep them out of the hospital, out of jail and things like that. And that was very rewarding and very never a dull moment kind of
Hmm.
experience. Community mental health centers, telehealth, locums, all of the things. It was never the psychiatry for me that was problematic, but as we know, the systems in which we sometimes work, and I definitely found this, didn't always operate in a way that aligned with what I thought was best for taking care of patients. And I remember one of my last employed positions before I started charting my own path was at a really busy community mental health center where it was very underserved. They hadn't had a psychiatrist there in 6 months or something before I came. And there was a lot of pressure there was a big backlog of patients basically, and a lot of pressure to see as many as possible. And my schedule was always double booked and very crammed tight. And these folks were really sick, and the expectation was that I would churn through them 15 minutes at a time and 25 patients a day. And I could keep up with that pace. I'd learned in residency how to keep up with a fast pace, but it no longer resonated with me to do that. I really felt we weren't, just as a system and even just as a individual doctor, that it was doing the patients a disservice when I knew they needed a lot more than just a 15-minute med check. And forgot where I was going with that. But that was one part, that was like a turning point for me. I think like realizing that working in that way probably wasn't going to be a good long-term fit for me. And so I kind of started exploring some other things after that.
Yeah. So when you're seeing 25 psychiatric patients a day, I'm thinking that you might literally have them in and out of your room, but how much of that work was being done in terms of the completion of that note and the doing of the orders and tasks, and where was that work being done?
Yeah, that's a good question. So I was actually very efficient by
Mhm.
this point. And when I was a resident, I'm going to just back up a little bit. When I was a
Mhm.
resident, I really struggled with my notes. And I knew, and I was the kind of doctor who would spend my full appointment with the patient. And then I'd think about notes and orders and things after the day was done, which meant that I always had the stack of work to do after the day was over and after my brain was spent. And it created this big backlog. And it was definitely a problem in residency. And I had an attending who saw what was happening and pulled me aside one day and gave me a big mindset shift that I took with me after that really changed things for me essentially. And what he was sharing with me was that whatever time that I have for my appointment blocked in the schedule wasn't only for seeing the patient, but it was also for completing the note and putting in the orders and completing the entirety of the visit, which seems straightforward now, but was not something that I had in my mind. And once I made that shift and I took that with me into this other job where I had 25 patients a day, I really was able to complete all of that within that short block of time, the note and the orders, using lots of templates and things like that. But it wasn't always that way. And I had to kind of learn the hard way as a resident how
Mhm.
to move very quickly. That being said, even though I could do it, it still didn't feel comfortable to be moving at that pace.
Oh, 100%.
Yeah.
Yeah, I was just wondering how you were looked after in that space as well, because if we're asking you to do something already that is impacting on you in terms of I can't give care in the way I want to give care, but we're also then delaying work. So we're further injuring you in this process. That's just not fair. I
Yeah.
guess what I wonder then, what was it that helped you be able to contain these very sick patients to 15, well, not even 15 minutes, because as you said, you're getting your note and your orders done. So you're literally having 5 to 7 minutes with a very sick patient. That takes a skill set,
Yeah.
Jeannie. That
Yeah.
takes a skill set to really focus in on what's needed. That shows further training that you've done for your own self in that encounter space.
Yeah. That's a good question. I haven't thought about what made that possible, but let me think about it because that's a really good question. I do think one thing that you learned as a resident, especially in training, even though the setting was very different, it was not in a hospital, it was in a community mental health center, but was like how to triage and like how to identify what's the most important, how to set expectations early on in the beginning of the visit, right? That we might have to bring you back for some of the other things. Like we're here mostly to focus on how you're doing with their medications, which is what we could do in that time period. So yeah, I think being able to very quickly identify what's the most acute, what is a danger, right? Something that constitutes a crisis. Let's get that out of the way, of course. After that, let's see like how we're doing with these medications. And after that, we know from the beginning that this is going to be a short visit, unfortunately, and we'll bring you back, or maybe we'll have you connect with your therapist and things like that. So I hope that answers the question.
I think it
Yeah.
does. Yeah, it helps us see what is it that you had to do to survive in that space and do the very best you could for your patients with the allocated time? Like you said, it's not ideal. It's not how you want to practice medicine. It's not something I can understand why you wouldn't want to do that forever in that
Yeah.
way. It served a purpose in the moment, but it wasn't good in terms of looking after you too and looking after your patients in that space. Tell us what it looked like for you to say, this isn't good for me, it's not good for my patients, I can't stay here, I'm going to transition to something else. Were you talking to others about that? Were you just self-reflecting about that? What were you noticing in yourself about that at that time?
Yeah. I think it was a lot of self-reflection. I don't remember at that time having anybody that I felt like I could talk to about that. In that particular setting, I never interacted or knew that there were other doctors, just the way that the clinic was set up. And it really just felt like me by myself. And so this was a lot of self-reflection for sure, and not having much of an outlet to express like how I was feeling about that. I will say at that job, something happened that kind of made it much more clear to me that I needed to make a change. One day I was seeing patients as usual and I received a phone call, and normally would never answer my phone except it had the name of a hospital out of state on
Mhm.
it. And that state happened to be the one my husband was traveling to. He was away for work. And I answered the phone and was told by the woman on the other end that my husband, who was out of state and at an appointment, had a code blue was called on him. So he coded while he was like at a medical appointment. And so this is like in the middle of a extremely busy, overbooked day as usual. And of course, normally I would have no thought at all about ever ending a workday early is something I would never do. And I think probably most doctors can relate to that idea that you have to just keep going, right, with your work. But it was such an urgent, emergent thing. And so I had to stop and I let the clinic leadership know what was happening. And I had to leave right then and go out of town to where my husband was. And so what happened after that, what that moment showed me, I needed something very dramatic like that, first of all, to realize and shake what I call the mirage that
Mm.
I was under, and I think a lot of physicians are under, which is the idea that the work always comes first at any cost. That's the way I was thinking and trained. And like I said, this place was very underserved. And so there was a lot of pressure to save the day is what I felt like all these patients haven't been seen in months and I'm the only person here. I've got to help and I've got to extend myself. And I think the message to myself, and some of this came from the outside too, is like, if I'm not there, it's all going to fall apart, right? If I were to take a day off or step away from clinic or something dramatic will happen to the clinic and the patients and things like that. And what I learned in that moment was that that wasn't true. Actually, the clinic did figure it out. They rescheduled and did whatever they had to do on the admin side, and the patients were okay until I came back. And that was a powerful lesson for me. It started to break through some of the mirage that it all weighed on me and my shoulders, and
Mm.
it broke through this idea that it was impossible for me to do anything different or step away. And also it just reminded me that life is really short, and it was important for me to have some kind of flexibility in the way I practice so that I could be there for big moments and small moments and other moments outside of work that mattered. And that ended up, after that happened, I stayed for a while, but that ended up being my last employed position. I started looking to see like how could I create more flexibility in my practice as a clinically practicing doctor. So yeah.
Yeah, that's not a good way to end a clinic day and a bad situation. Yeah.
Yeah.
Oh boy. All the
He's
feels.
okay, by the way. He's perfectly fine now. So that it was a
Oh,
scare, and
that's good.
I always forget to remind, or I always forget to come back to complete the arc of this story. That yes, my husband's perfectly fine now, and I'm grateful for that. But yes,
That is
it was
good
a
to
scary day.
hear.
Yeah.
Yeah. Tell us what the transition looked like and why you ultimately decided not to go back to an employed position.
Let's see. Like I said, lots of reflection over time. It wasn't like a one, it
Hmm.
wasn't like a one thing, but just thinking over time. Since I'm not totally satisfied with the way medicine is practiced in any of these larger organizations, and
Hmm.
I think that it should be done differently, and I would like to serve my patients in a more complete, holistic way. I think that
Mhm.
naturally led to some thoughts about maybe I should do my own thing one day. Maybe I should
Mhm.
start my own practice or my own clinic so that I can do that. But that's a thought that I sat on for a really long time. I didn't know how to make it happen. And I did what I think maybe a lot of physicians do if they're anything like me, which is do my research and maybe talk to some people and make some small steps around this. But lots of time went on, years went on with this idea without me actually moving forward with it. And I think there's a lot that goes into the idea of charting your own path, of course. I had worked really hard, of course, to even become a physician and a psychiatrist and to land these jobs and all of that stuff. And so it felt a little bit of that sunk cost fallacy. And why would I give up something that I'd worked so hard for or switch? And then there's the stability that comes with having an employed position, and trading that for some uncertainty was also a bit unnerving. And again, going in a path in a way that I didn't necessarily have mentors or anything around me to show me the way. And it was a long transition, is what I'm saying. And ultimately, after spinning my wheels for a while, I did enlist the help of a coach. And that's like when I was able to start making some moves forward in terms of switching my practice style and moving more towards my idea of starting my own practice. Even that, though, was not a one. It was very
Mhm.
steady as well, right? I continued to practice clinical medicine. I just did from employed to locums, and locums gave me the opportunity to continue to see patients, but I could negotiate my salary a little bit. I could negotiate the days that I worked and things like that. And so I felt like I had a little bit more of that autonomy and flexibility that I was hoping for. And then I could still see patients. It was a win-win in many ways, at least for that chapter. Yeah.
Got it. Yeah. It's interesting. It's locuming because locuming puts a different flavor on it because you don't know this person. They're on a program or a treatment program, and then you get slotted in to do whatever's required at the time and then hand them back off again. Did that take some rewiring of how or redesign of how you see patients, how you approach that encounter?
That's a good question. So actually my locums experience was different because it
Mhm.
was local, and so I was in driving distance from the place where I worked, and it was an ongoing need, and so I stayed there
Mhm.
for years. And it wasn't like I was there, it was almost like I was employed. I just had a little bit more flexibility, but it was a long-term assignment. I still had the same patients for several years, and so it did not require rewiring in that way, though I know what you mean. And I think that would have, maybe that's why I never did the kind of locums
Mhm.
where you go out of state and are there for short assignments. That probably isn't quite my jam. So I was lucky to find a long-term assignment close to home. Yeah.
Yeah. Tell us what you're doing now.
So what I'm doing now is what I've always wanted to do, but never
Mhm.
imagined that I would do. I am in private practice though, but as a coach, and I work with women
Mhm.
physicians, and most of the women that I work with as a starting point are dealing with burnout, and lots of times honestly they have comorbid some depression and anxiety and all of the things, but burnout is what we're working through, and oftentimes they're looking for ways to make medicine sustainable for them. And for some, that means like, how can I create more joy and happiness in my current practice? How can I create more balance while I'm here? And for others, it's like, how can I finally make this transition into this next thing that I've been dreaming of, whether it's non-clinical or entrepreneurship and things like that. And I say it's what I've always wanted to do because I really am able to bring my background as a psychiatrist. I'm also trained in cognitive behavioral therapy. I'm really able to bring some of that lens into a coaching non-clinical
Mhm.
sphere and really impact people that I genuinely love and respect. One of the cool things about entrepreneurship is you get to decide who you want to work with. It's a little bit
Mhm.
different from being in the clinic where your patients are handed to you. I kind of get to decide the group of people I most wanted to help. And so I decided on women physicians just because I've found so much camaraderie and likeness amongst us as women physicians. We have a unique shared experience, right? And I know that when I was trying to get started on charting this path, I relied a lot on the support from peers as well as the coaches that I worked with, mostly or all are women physicians. So that's who I wanted to work with. But anyway, what I'm saying is I get to bring this desire that I've always had to impact the way people feel and feel better, which was always like the point of
Mhm.
being a psychiatrist, it's just what I couldn't really do it in the way that I wanted to within the traditional practice that I was in, but also take it further too, because I think one of the interesting things about discussions around mental health and psychiatry is that the goal is to get somebody from unstable to stable or from crisis to, even ground. And what I love about coaching is that I'm able to take someone from stable to what I call thriving and flourishing and really follow that trajectory. And so I work with my clients longitudinally, just like I've always wanted to. You asked about if I could do the in and out thing. Probably not. I tend to work with my clients for years. And I love seeing this growth arc and this trajectory and this transformation that goes a lot further than just getting stable to really enjoying all aspects of their lives and integrating all aspects of their lives. That's what I do now inside my practice.
Very good. What does burnout mean from your perspective then when you're thinking about the women physicians that you look after?
Yeah. When I think about, so we all know what the kind of textbook definition of burnout is and the criteria and how it's seen as an occupational phenomenon when in response to stress in the workplace and all of that. What I see is burnout, like the thread that kind of ties all of my clients together, is really the result of a misalignment that happens, right? There's a departure, I think, for all of my clients from their selves, their bodies, their emotions, their values, their dreams. There's a disconnect between those things and what they're actually doing and how they're actually living their lives. And it doesn't happen overnight. A lot of my clients talk about like how, and I understand this, like how as a almost as a way to survive like the rigor of medicine and the training and even the practice of it, have to disconnect from their bodies and their emotions. And I think anybody listening can relate to the missed lunch breaks or the bathroom breaks that you forego or the fatigue that you push through. There's a disconnection and from what you need as a human being and like how you're actually living. And that's one part of it. And I think that disconnect continues and that misalignment continues, right? Like where lots of my clients end up in medicine or practicing in a way that is different from how they initially imagined, right? It no longer aligns with their values. And I found myself in the same position. I was talking about this earlier about like how I think patients should be taken care of in a holistic way and should be followed longitudinally and should be helped in this much more broad way than I was able, but working in a system that required me to see patients in 15 minutes, right? That's a misalignment between my values and what I think is right when it comes to taking care of people versus what I was required to do. It created like a degree of burnout for me too. And lots of my clients also are feeling misaligned there between their values and how they're required to practice. Moral injury is the common way that's described. I think there's a misalignment and a disconnect too between their dreams. One of the things that my clients often come in with is either dreams that they've of their own that they put on the back burner because they're women and they're physicians and they're socialized to take care of everybody else and put themselves last and develop this idea that I'll get to myself when, right? Like in some remote future that doesn't have a defined date and years goes by. And then others, like I think just because the way the parts of our brain that are required to practice medicine are very different sometimes from the parts of our brain that can dream and play and all that. There's a disconnect there too. And so some of them don't even know it becomes like, what do I even want anymore? Right. It's been so long since I've dreamed and I'm so stuck in this doing robot mode that I'm not even sure what path I'm on and what I set out to do and what I really want. And so that can create a lot of friction and misalignment as well. And I think the last thing is just a disconnect and misalignment from this probably encompasses all of it, but from us as human beings, right? I think medicine sometimes requires, again, there's so much doing and so much stuffing down of emotion so that you can remain objective and professional and so much, all of that, like that we forget what makes us human is feeling and emotions. And we lose that ability to be kind and compassionate to ourselves in the way that we are to others. And so we can start to feel like robots just as much as people try to treat us as robots sometimes in medicine when you get really good at being a doer. And so to wrap all of this up, right, I think I really see burnout as a misalignment between these very important parts of what makes us human beings. And so it's the coming back to who you are at your core that that addresses it and fixes it and really helps people move forward.
I think that stuffing down thing that you're talking about. So on the outside, you look like a regular human. You're going to work, you're doing the things, you're put together, you're professional. And on the
Yeah.
inside, you're, I don't know, withering or robot feeling, or just that stuffed
Yeah.
aside your own desires and dreams and humanness for the
Yeah.
purpose of getting to do the things,
Yeah. Exactly.
but within a system
Um,
that's not caring for you.
yeah. Yeah. That's exactly right. I think every person that I've ever worked with anyway relates to exactly it described in that way where everything is looks good from the outside, but inside it doesn't feel right and they're just pushing through and stuffing down. And it is a survival mechanism, but also at some point you got to at some point we have to reconnect with who we really are as people. So yeah.
Yeah, yeah. Have you got any examples of physicians you've worked with and what it looks like to have made this change? What, because it's sometimes hard to conceptualize, but what does it look like to come through burnout? What does it look like to redesign it all? Or do I have to move states or get out of medicine? What does it look like? Can you help us just kind of show us what a story of that looks like?
Yeah. It looks different for everyone and for some more dramatic, some of my clients more dramatic than others. But I think one core feature of being on the other side of burnout for all of the women that I work with is going from a place where you're at the bottom of your list of priorities. You put everything and everyone else ahead of you. You're depleted and exhausted and also oftentimes feeling very trapped in whatever life you're living, whether it's I have to stay with this job because I'm the breadwinner here and I just have to sacrifice my body and my life to take care of my family or whatever the case may be, the sense of like stuckness, going from that, which is a terrible experience, right? And
Yeah.
yeah, getting to a place where you say and you really believe I matter too. And I'm worth prioritizing, and my life is my life is worth making the most of. And it seems like a small thing, but what it means, like when you believe that, like once you've shed some of the conditioning and the beliefs and the all the stuff that like got you there in the first place, it means that you can now make decisions about your career, right? You can start to see that you're not stuck, right? And so what that looks like is maybe you are in a particular job and you've been there for a long time and feel like you're destined to be there, even though you're really burning out. To some of my clients, putting an application somewhere else or landing new jobs elsewhere. And it frees them from, it starts to poke holes in the mirage that they're stuck and this is just the way it has to be, right? So there's that freedom that comes with that, whether they leave or not. Like it's very powerful to know that you have choices, for an example. Or it's in personal life, being able to say, like, once you understand that you're worth prioritizing and that being at the bottom of the list, there's no reward for that, right? Once you start to understand that, then they're able to set boundaries in their lives without feeling guilty about it. It might look like, so I have a client right now who shared recently how she went from being like an hour behind in clinic every day because she was always saying yes to overbooks that admin would ask her to overbook her appointments, to now carving out little slots of time for her to catch up in her schedule so that she wouldn't fall behind, and saying no more often to overbooks and not feeling guilty about that, but really enjoying that. One, she gets to go home on time, which is awesome, and be with her children, but also her patients benefit because she's not torn between two rooms at one time or so overbooked that she can't like really attend to the person that's in front of her. She gets to see that like when she puts herself first in a way, that there's this beautiful ripple effect. And again, she gets the benefit of feeling more on top of her day, more empowered, and also home to see her family. It can look like, for another of my clients, she called it like the golden handcuffs of medicine. So like really being very burned out for like many years before we started working together. But she has aging parents who rely on her income along with her. She relies on her own income. And so feeling she was stuck at that place, to eventually putting in her notice and then landing a job in a non-clinical sphere. And now she's an entrepreneur and now she's helping other women physicians do it. And so, like I said, it can be more or less dramatic, but I think like The thing that ties it all together is that once you unlearn some of the things that we have learned really well, which is to sacrifice yourself to until you've given it all away. Once you've unlearned that, then what becomes possible is whatever you want, whether that's enjoying medicine more because you're not stuck, or moving on to a practice setting that works better for you, or just being more present as a mom or a partner, or being able to engage hobbies and take better care of yourself, which just makes you feel good. All of those things are on the other side of burnout for the women that I work with. And it's really fun to see.
Yeah. How do people find you if they're looking to connect and learn more about what you're doing?
My website is a good place. JeannieLawrence.com/sanctuary. You can learn a little bit more about the program and book a call with me. Booking a call is the best way to kind of see personally, right? I'll talk to you individually and just see if this is a good fit for you, if you're kind of thinking that you'd like less burnout and more balance. So, yeah.
What have we not talked about that we should be talking about before we close up?
That's a great question, Sarah. What have we not talked about that we should be talking about? I don't know. I feel like your questions were very good. I think that one of the things that's really important to me, and I kind of touched on it before, and I do see it as the linchpin to bridging the gap from burnout to what's on the other side, like what you just asked about, is something that I call emotional mastery, but it touches on like what makes us human, right? There's so much talk right now, by the way, about AI and tech and bots and the machines and all of these things that can do all of these incredible things, right? And are changing the world really rapidly. But what makes us humans, and I think will never change, is our emotional core. And what we're not taught as women physicians, or as anybody really, is the importance of our inner world and our emotional state. And I say that because, like I kind of talked about before, the disconnect and the conditioning that we have to shut off our emotions and stuff them down or put them in the closet somewhere. I see lots of women physicians in the beginning of our work together ashamed and disconnected from the feelings that they have. What I want people to know is that the ability to face yourself as a human being, which means to face yourself and your emotions in a really healthy way, not in a way that's going to cause you to break down or be in tears at work or anything. This is not what we're saying, but in a really process in a really healthy and systematized way, is the difference between kind of staying stuck in a practice setting that doesn't serve you versus being able to move past that and thrive on the other side. It's the difference between kind of staying stuck in a burnout cycle for years and years, like my clients often are doing when we first meet, to being able to make a transition. It comes from understanding that you have emotions because you're a person. That's okay. That there is a process for you to start to feel those emotions instead of stuff them away. And when you do, then you're empowered to move forward in your life from a place, by the way, of self-compassion and understanding and acceptance of yourself, because a lot of the emotional avoidance is about feeling like there's a part of you that is not okay, the part of you who feels really sad at the end of a difficult case, or who's angry about the system that you work in, or whatever those emotions. There's a lot of shame that women physicians can face. Some of those emotions feel unacceptable, but that's a rejection, I think, of yourself and your humanity, and there is a different way to relate to yourself. And when you learn how to do that, and I call all of this emotional mastery, this like kind of self-compassionate turning in towards your emotional state and your human side, then you can take your whole self into your next chapter. That becomes possible, and that's really beautiful. That's what my clients have found. That's what I found. I love what I get to do now, and I don't think I would have been able to land on that if I was still where I was before, of trying to separate right, my dreams and desires and who I am as a person from my professional side. So now I get to blend it all together, and I think that's whatever that version is for anyone listening is possible. But it does take a turning in towards yourself and acceptance of yourself as a human being who has emotions.
Yeah, I'm just thinking back to the example of the woman physician who's double booked, and so she's an hour behind. And I hear a lot of that guilt associated with saying no to the extra booked patient, or guilt about saying, I need some space here to be able to manage the complexity of the day. So I'm not an hour behind. And that feels selfish because it's so that I can get home on time and look after my kids. And it's not just about that. But at the same time, we hear that a lot, don't we? That I feel guilty about setting about it. If I say no, I then just swim in guilt. What is it that you think helps to allay that guilt of asking for what you need? Because we say even identifying what you need is hard.
Mhm.
Asking for it is a whole nother world of pain because
Yeah.
they're difficult conversations that shroud you initially. If you're not doing this emotional regulation work and understanding that self-compassion, it just feels so overwhelming you don't even ask for it.
That's
Or
right.
you ask for it, and when they say no, you're like, of course they're going to say no, and you just accept that no.
Yeah. Yeah, so this is exactly what I'm talking about. So thank you for asking that. Yeah, there's a difference between most everybody knows that they should say no more often or set more boundaries. There's a difference between knowing that and actually being able to do it. And the difference
Mm.
is the emotion. Do you know what to do with the overwhelming guilt that might come with saying no to this overbook? So your question was like what's a tip around like allaying
Mm.
some of that guilt, and it's the opposite of what most people think. Usually what we're waiting for is to not feel guilty, and then we'll set the boundary, or to feel really confident in doing it, and then we'll set the boundary. That day never comes, right? That day that you're not going to feel guilty about saying no to an overbook probably isn't going to come, especially not at first. With practice it will, but at first it's not. And the shift is recognizing that instead of trying to get rid of the guilt or waiting for it to go away, that it's okay for it to be there, to actually turn towards it. I feel guilty right now about setting this boundary. You could say that aloud and then stand like what's underneath that, because we're framing it like if you're trying to fix the guilt, it's because you feel there's something wrong with having the guilt, right? Where the
Mhm.
truth is that the guilt is what makes you not only a human being, but it's also a reflection of your values. So if you feel really guilty about saying no to an overbook, it's probably because you have a lot of values around being a team player. You probably have a lot of values around being able to just take care of people who are in need right now. Like at the end, right? These are good things about you, right? It's
Mhm.
amazing that you're a team player. It's incredible that you want to take care of your patients, and understanding that's the only reason that you feel guilty in the first place. And there's nothing to be ashamed about that, right? It's just, in other words, the guilt is nothing to turn away from or to try to get rid of. It's something to understand and lean in, because it's giving you important information about who you are at your core. And doctors are amazing at their core, right? That's why you're a doctor. And so lean into the reason, understand and lean into the reason you have the guilt. When you do that, it releases some of the control or the power that emotion has over you, because now you're siding with it as opposed to being at war with it or waiting for it to disappear, right? Now you and the guilt are on the same team in a way. You're no longer fighting yourself. And then it makes it that much easier to be like, okay, I do feel guilty about this. This is coming from a good place. I embrace this part of me. I understand it. Therefore, I can feel it and say no with a lot more ease. So, yeah.
I love that. Okay. So it's not that we're going to completely become hard ass bitches. It's we understand why we're guilty
Yeah.
and we lean into that and say, of course I feel guilty about this because patients are one of the priorities when we're at work and we do love being team players. And I'm creating room for what I actually want to prioritize right now, which is getting home to my kids.
Yeah. That's okay. What's wrong with that? Yeah. Yeah.
Beautiful. I love that. Thank you, Jeannie. I think that's really helpful for people because I've just seen recently a lot of people tackling this guilt of, oh, I'm trying to set a boundary and they keep asking. So I keep saying yes. I'm the weakest link. I can't handle the guilt of saying no to that. And so it just keeps them stuck in this cycle. And I think that just recognizing guilt's normal. It's
Mhm.
because of your values, which are
Yeah.
good values. You're good at the core
Yeah.
and you're allowed to have choice here too. So
That's
yeah.
right. Yeah. Good. I'm glad.
Beautiful. Thank you so much for this. All
You're
right.
welcome.
We'll leave it there and I will let you all to your week. Thank you so much, Dr. Lawrence, for coming along today.
This was awesome. I appreciate the opportunity, and thanks for having me.
Yeah. All right, everyone, have a great rest of your week. Bye. Hey, if you found this podcast episode helpful, I would encourage you to like and subscribe. Every time you do, you help a colleague or friend find our podcast, and it can help them too. Don't forget to share it along with your friends. If you're looking for extra help, don't forget we have Charting Champions for physicians and Smarter Charting for nurse practitioners and other clinicians to help you get home with your work done. We are helping you create sustainable clinical medicine. Thanks for listening.